Mr. Secretary and your team, I want to begin by thanking you on the focus that you're bringing to our veterans. In particular, I appreciate the shortening of wait times for access to health care. In my state, you brought the backlog, which got really high during the Biden years, down to a much more workable level. I know you've been putting a lot of effort into that, Mr. Secretary, you and your team, so thank you for that. And I know what you're trying to do is deliver better care. You're doing that with a genuine heart for our veterans, as a veteran yourself and still serving, actually. So I want to thank you and your team for all this. It's not easy work, right? This is the biggest bureaucracy in D.C., and a lot of people have tried to reform it, and it's a challenge. I want to start by, as you're working through the restructuring on the healthcare side, and I know it's a big undertaking, I have some questions, but the one issue I want to make sure your team continues to focus on, and we've talked a lot about it, is community care. And that is deeply important to Alaska. As you know, Alaska has direct access to community care because of a provision I included in the 2018 Mission Act. And a lot of the VA, if they're not VA officials in Alaska, they don't get that, right? They don't remember that. The provision applies to states without a full-service VA hospital. That's Alaska, it's New Hampshire, and I believe now Hawaii. I'm not sure what the status of Hawaii is. And so that's just in the law. And during the Biden administration, there was an internal memo which tied bonuses to keeping veterans inside the VA system. Now, look, I have no objection to veterans receiving care within the VA system when that works. But as you know, Mr. Secretary, in my state, it doesn't always work. And the law says, hey, the veteran can go out and get community care, period. That's end of the story. So how are you making sure that we, as you're doing the reforms, that you're going to still focus on community care, because it's really important, and the last administration tried to put their thumb on the scale on that, even though the law said my veterans get to go into the community to get it because we don't have a full-service hospital. And by the way, we got more veterans per capita than any state in the country in Alaska.
Yep. Senator, the community care aspect is actually will be enhanced by this, especially with the HSA part of that, actually looking at the needs of individual hospitals. We have several that, if you go to New York City, you have 4 or 5, within just a number of square miles, all urban, all a highly density area, which has a different need than, say, in Alaska, which has the no hospital, but also has a lot of community care. So this will actually give us a more hands-on approach to looking at how each of the systems operate as we go forward. And then our new community care contract, which is, was required to after a number of years, is being led in a way that is going to enhance our ability to do third-party and expand our third-party network. And if you're just a second, Mr. Bartram would like to answer a little bit of that as well.
Yeah, sir, there's no plans to change anything relative to the community care
really
structure.
what I wanted to hear.
I mean, as the Undersecretary, both community care and the direct care system fall under my preview on behalf of the Secretary. And that will happen even after we go forward. The community care contracts will still be ran by us.
Good.
It's our program. And one of the things that I want to point out is, as you know, and you've been actively involved in the decision that the Secretary made last May on best medical interest. And the best medical interest of allowing veterans to be able to go out to the community when it's the best medical interest of their doctor, which is even outside of the flexibility the state of Alaska has, that's increased by 66% because of the decision.
Good, because at the end of the day, that's what we want, better care for our veterans,
right.
No matter how you get it. Let me ask another quick question, and this is going to, Mr. Secretary, you and your team, I'm going to, I have skepticism of VISN realignments. The last major one that took place, which went from 21 to 18, completely overturned the system in Alaska. It was an unmitigated nightmare. That wasn't you guys. That was a long time ago. I've spoken many times about the unique challenges. I still want to pitch to you and your team, even as and we're working closely, and I appreciate the outreach with my staff, but I want to continue it. But to look at Alaska as a separate VISN. I know this is something that you haven't agreed to yet. That, and then on the HSA issue, we were told, well, if you're not your separate vision, because you're very unique challenges, and you've had challenges when there's been vision reform before it really collapsed the system in 2015 and 2016 in my state, that at a minimum, there would be an HSA solely committed to Alaska. And then we heard from your staff, well, maybe the HSA is going to be combined with Hawaii. No offense to Hawaii, I love Hawaii, but we don't need to be combined with Hawaii. That's not a good idea. And I don't even think Senator Hirona would like that idea, right? So I'm still pushing for some structure that gives my state some ability to have you guys look at the unique challenges, because whenever we're put in the place with other lower 48 communities, it's so different up there that mistakes get made. And the last time this happened, it wasn't just a mistake. The system collapsed in my state, and thousands of veterans were not served. So can I get your commitment, Mr. Secretary, and your team to continue to work on advocating for this? I know you're looking at it. I know you're skeptical, but I am not done making my arguments with you.
Well, I've learned from my Air Force career and also my previous, when I started the Navy, work with my Marines, I don't continue to go up against Marines and not try to at least find a solution. So we're going to continue to do that, Senator, as we look forward. And that's one of the reasons we're here today to
I know,
explain
and
this.
I get it. And look, I appreciate you coming. You know, you get worked over in this committee, and you're taking it, and that's part of the oversight role, and my colleagues on both sides of the aisle do. But you do it with class and dignity, and your team's heart is, in my view, in the right spot. It's about taking care of veterans, number one, number two, number three. That's what the VA is all about. So if I got your commitment to continue to make the advocacy for my state, that's what I want. So
Senator
thank you very
Gago.
much.